Hello, dear friends. So good to be with you today. And we've been on this series talking about C-session, talking about Caesarean session. And today I will be landing that plane today. And earlier we've talked about maternal reasons that affect the woman or affect the mother that will lead to Caesarean session. And we also talked about fetal reasons that will affect the baby that will lead to Caesarean session. Today I want to talk about a combination of both maternal and fetal reasons. Factors, when you combine these factors together from the mother and from the baby, you say, well, the best thing to do is to do a C-section. I'll talk about those factors today. So they are called maternal fetal factors. And really, it's pretty much some of the things we've talked about earlier. We're just going to pull them together that makes decision strong to do a C-section. Many of these cases, maternal fetal factors, are factors that you consider in a prenatal period, in the antenatal period. You're looking at for instance, you're looking at a woman who is pregnant or carrying her first pregnancy at the age that is above 35 years. Okay, we call these people elderly primigravida. She's carrying her first pregnancy above 35 years. So that's a maternal factor. Her age is a factor. And you're looking at the stature of this woman, you're feeling that she's not so tall. Maybe she's of short stature, maybe 1.50 meters or thereabout, or slightly above 1.50 meters. So you look at another maternal factor. Then probably you look at the clinical evaluation of the baby close to term, at the period of term, 37 weeks and above. You see that the baby appears big, clinical evaluation, or you do an ultrasound, a late third trimester ultrasound, and you discover that the baby appears big, anything above maybe 3.8 kilograms, estimated fetal weight, estimated weight of the baby. You look at this combination of factors and you look at her and say, well, putting all these factors together, one, you're having your first baby above 35 years. Two, your age is a factor which I've mentioned. Your height is also a factor. You're not so tall, and your baby appears big, probably estimated at 3.8. It is safer for you to have an elective section. So that would be a reason. A combination of factors of maternal and fetal factor. I just painted one scenario. Or probably you have a woman who have been trying to get pregnant, she managed for infertility or subfertility for a period of time, and now she's pregnant. Or she did an IVF, assisted reproduction, and now she's pregnant. You're looking at this baby and you're looking at the woman is like 35 years old, and you're looking at a combination of factors. You say, well, this is like what we call quote unquote a precious. All babies are precious. So quote unquote a precious baby. So you want to do a cesarean session for that particular patient electively. Or possibly you have a woman who has pregnancy-induced hypertension in the prenatal period, or pregnancy in the prenatal period, and you understand that she's carrying her first pregnancy. You don't want to induce labor. You just say it's better for us to go for C-section from the beginning. She's carrying her first pregnancy at an advanced age. I must qualify that. And you look at it and you say you want to go for Caesarean session. So it's really a combination of factors, not one factor. But in the wisdom of the caregiver, I want to counsel you and say, well, this is not really an absolute indication of Caesarean session. It's relative, but I'm looking at all these factors together, and we want to do C-section for you. And there's also the condition where a woman will just request for C-section and say, look, this is my preference. Although that is not really taken technically as a reason to do Caesarean session, but in some places, some people honor the request of the woman and they do that. So a combination of factors in the mother, combination of factors in the baby will be a reason why you want to do that kind of C-section. So that brings my series on Caesarean session to a close. So to conclude, to let you know that Caesarean session as a mode of delivery is an acceptable mode of delivery. The ultimate goal is to ensure the safety of mother and baby. So Caesarean session is not a curse. Caesarean session is not a negative thing. Caesarean session should not carry stigma. Caesarean session is safe in most climes. If the right person is performing the surgery in the right environment, is a very safe procedure for delivery. And it doesn't demean you as a woman. It doesn't say that you are not carrying your baby like the Hebrew women, as they say. You're not delivering your baby like the Hebrew women. You are also having a good delivery. No woman should feel diminished because she had a baby by Caesarean session. So I bring that to a close. Till we meet next time and start a series. You take care of your health, and be blessed. Bye.